welcome to today's webinar, When Collective Impact Has Impact, the Collective Impact Fieldwide Evaluation. Once again, my name is Galen MacLusky, and I'm the Director of Community Innovation for Tamarack's Learning Center. And I'm really just here to introduce our discussion today with Terri, Akey, and Lauren Gase. So Lauren is a senior researcher at the Spark Policy Institute. She has expertise in quantitative, qualitative, and mixed methods research and evaluation, having led a number of studies at the national and local level to improve health, educational, and social outcomes. She enjoys using approaches, methods, and data analysis techniques that meaningfully facilitate stakeholder engagement, influence policy and program decision-making, and foster organizational improvement. Before joining Spark, Lauren advanced health by promoting policy and systems changes as the Chief of Health and Policy Assessment at the LA County Department of Public Health and as a health scientist at the Centers for Disease Control and Prevention. Much of her work is focused on identifying ways to improve the holistic health and well-being of youth and families in partnership with multiple sectors, including the education and juvenile justice systems. Lauren holds a BS from the University of California, Santa Barbara, a master's in public health from Emory University, and a PhD in health policy from the University of California, Los Angeles. Welcome, Lauren. And Terri is a director at ORS Impact, Social Systems Policy Research, Evaluation, and Capacity Building. Dr. Akey holds deep expertise in policy research, program evaluation, and evidence and data use to promote organizational and systems learning and change. She conducts complex, mixed method studies, formative and developmental evaluations, survey research, assesses large-scale systems change, leads strategic planning, and advises intermediaries, nonprofits, and state and local education agencies and other stakeholders on how to better serve communities, families, and children. She specializes in collaborative approaches to research and evaluation, working side by side with community and education partners to obtain and use actionable evidence to define and achieve success and create access to opportunities and capacity to reach those success goals. So welcome both Lauren and Terri, and thank you for joining us on today's broadcast. I'm very excited to hear from you.
Great, thanks. So what I want to do is start off with a brief overview of the study goals and the methods. As most of us are familiar, since Kanya and Kramer published their article on collective impact in 2011, there's been a lot of interest and attention on the collective impact approach. But until now, there really hasn't been a methodologically rigorous study that's looked across multiple collective impact initiatives to systematically explore the results they're achieving, the challenges they're facing, and the lessons they've learned. Early last year, the Collective Impact Forum hired ORS Impact and Spark Policy Institute to conduct an in-depth study of collective impact. The study was designed to address 5 primary questions, and these were oriented around when and how collective impact approaches lead to systems and population level change. There were also secondary questions that focused on exploring how collective impact was being deployed, including the conditions and the principles, and the context, challenges, and barriers that the collective impact initiatives were experiencing. So if you go to the next slide, you can see that the sample included 25 collective impact initiatives, and these were selected from over 200 nominations, and they were selected based on their location. We focused only on the US and Canada. The length of time in operation, we looked for sites that had been implementing their initiatives for at least 3 years and had some evidence that they were implementing the collective impact conditions. So among these 25, we examined 8 of the sites in more depth via site visits to more rigorously test the approach's contribution to population change. And we examined 3 of these sites in more depth to better understand their equity work in the collective impact context. So if you go to the next slide, you see here just a few pieces of information on our methods. I'm not going to go over these in a lot of depth, but did just want to briefly mention that for all 25 sites, we conducted interviews and reviewed documents. For the 8 sites that were our site visit sites, we had a series of in-person dialogues as a part of that. And then for our 3 equity sites, we conducted virtual focus groups to better understand that component. In terms of the methods, we did develop rubrics that were used for a variety of pieces, including to examine collective impact implementation, as well as things like equity, systems change, and population change. And I'll definitely mention these again because I think they're a helpful tool. So I'll point out some of these pieces later on in the presentation. We also used process tracing as a method to understand the extent to which collective impact was contributing to change. And finally, we conducted thematic analysis. The last piece just to mention here is that we did have both an advisory committee and a steering committee that were helping to inform the study. So let's turn a little bit to the results. So a major goal of the study, as I mentioned, was to understand the relationship between the collective impact approach and systems and population change. So this visual shows sort of the generic theory of change under which we were operating. And I just want to walk you through it quickly. On the far left, you have the collective impact conditions. We hypothesized that these conditions would support early changes, which really laid the foundation for systems and population change. So early changes included things like increased partnership quality, collaboration, increased awareness of the issue among policymakers, among the public, increased availability and use of data, et cetera. Next, we have systems changes, and these are changes to core institutions within the initiative's geographic area, such as schools, human services systems, local government, private sector, community-based organizations, et cetera. And then on the far right, we have population change, which is really changes in the target population of the initiative, which could have been changes to people. So for example, increased high school graduation rates, or changes to the geographic area for environmental initiatives, for example. So this theory was really flexible enough to acknowledge that things are not always linear. So as you can see with the arrows, systems changes can sometimes support early changes. Likewise, implementation of collective impact does not always operate through that early change process. So let's take a look in depth at some of the changes that we saw. So based on the data and the process tracing method, the study determined that in the 8 case study sites, there was a strong contribution relationship between implementation of collective impact and the observed population change. What was interesting is that the nature of the contribution of collective impact varied by initiative. So 3 of these site visit sites had compelling evidence that CI made a strong contribution to population change, with low plausibility of an alternative explanation for how that change could have otherwise occurred. So for example, the Elizabeth River Project, an environmentally focused initiative in Southeast Virginia, has really been able to achieve systems changes and subsequent improvements in ecosystem health that went above and beyond the regulatory requirements. The degree of engagement that they've gotten from the stakeholders really seems implausible without the work occurring as a part of collective impact. So in the other 5 sites, the data provided compelling evidence that collective impact has been a necessary element of population change, but not sufficient. So really, there were other components that also significantly contributed to the change. So for example, in the Communities That Care Coalition in Franklin County, Massachusetts, stakeholders noted that the decrease that they have seen in substance use rates is also likely spurred by other pieces, such as standalone efforts at the school and district level, as well as other community and regional coalition efforts. So of interest, and I'll point this out, and we can come back to this later if folks are interested in the discussion, the 3 sites with the low plausibility of an alternative explanation, so the sites where there was the most clear link, had more focus on data, so they had more data strategies and really lifted up the importance of shared measurement. They had more focus on resources, so for example, implementing strategies such as collaborative funding type strategies, and less focus on political will and policies. Let's take a closer look at some of the early changes. So across all sites, we saw that that sites were achieving a range of early changes that were linked logically to, that sort of came from the conditions and set the stage for further outcomes. And I've listed here sort of 4 critical components of early work: building and enhancing collaboration, strengthening the quality of partnerships, so things like trust, increasing visibility or changing the way an issue was viewed or framed, and then building political will. Taking a closer look at systems change on the next slide, overall, most sites reported a variety of systems change, and these sort of fell into multiple categories. All types of changes were valuable. We saw in particular that 2 types of changes tended to be prioritized by site visit sites: new and enhanced services, so for example, adoption or scaling of programs and program redesign, as well as improved practices, so changes in the way work was done, use of a common framework, system integration, etc. So we also thought about different ways of thinking about systems change. And again, all of these were valuable. It's definitely not as simple as this is the type of systems change needed to achieve population change. Rather, thinking about what's most important sort of within your context. So we did see sites describing formal as well as informal changes, and really informal changes, sort of like a pilot program or sort of testing something out, were really an opportunity to sort of experiment sort of within systems. We also looked at systems change along the dimension of how many organizations were making the change, either one, similar types of organizations such as multiple schools, or diverse organizations such as a healthcare system, as well as a industry partner, for example, such as like a farm to hospital type program. And again, this was just, we saw that changes were present along many of these types of dimensions. We're going to talk now about the collective impact conditions and sort of how those were implemented in terms of the results we saw across the sites. So when looking across the sites, we generally saw strongest implementation of backbone support and common agenda. Sites were most likely to have emerging or no implementation for shared measurement and continuous communication. So if you look at a strong backbone, here are the 4 components that we saw about what it means to have a strong backbone. There were sort of 2 dimensions: having one or more organizational staff committed to performing those backbone functions, as well as a well-functioning leadership structure. So in terms of the backbone, it wasn't just about coordinating and supporting core activities, which was one component, but it was also about having the appropriate skills and credibility to perform these functions. In looking at the aspects of a common agenda, we can see here, it is about goal and vision. It's also about folks having a common understanding of the problem, as well as having this high level of buy-in for the vision, the goals, and approach. So I told you that I would come back to the rubrics that we developed as a part of this study. And so this is an example of the rubrics that we used for these two collective impact conditions. And so the rubrics are included in the full report. They're also there for equity, and Terri will talk about that in a little bit. But I think one of the useful pieces of the report that may be useful for your own work is using these rubrics as a mechanism to understand kind of current level of implementation and sort of opportunities for improvement along these domains, for example. They can be both an implementation and evaluative tool. So why is it important to have a strong backbone and a common agenda? So in our study, these two collective impact conditions were frequently prioritized as drivers of changes to systems and population outcomes. So what we saw is that backbones often play a critical role in convening partners, facilitating cross-sector collaboration, et cetera. Likewise, sites describe the importance of all getting on the same page together around a common agenda to identify and move change forward. Another interesting piece here is that sites with more mature common agendas were more likely to see systems changes that included policy change and changes to existing practice, as well as systems changes that required multiple organizations to align and shift their practices. We saw that shared measurement was an area where sites were really challenged. In looking at the shared measurement, we both looked at sort of, do they have the indicators that they're able to use to track progress, but is the measurement system providing useful and actionable information? So really we saw challenges with regard to shared measurement around three buckets. One, data not being available, right? Two, the types of indicators that were examined. Often shared measurement systems focused a lot on long-term outcomes. And while this provided a helpful snapshot of long-term progress, it really can be less useful for decision-making. And the third challenge was challenges to advancing a culture of data use within the initiative. So despite these challenges, when present, shared measurement was important. Sites that had strong stories of contribution, as I mentioned earlier, prioritized their shared measurement system as an explanation for how change happened. The last piece I wanted to mention here is communication. Again, this was an area where there were challenges for sites, and really these challenges center around finding effective opportunities for internal and external sort of feedback loops, right? So communication, we sort of conceptualized in two domains: internal, partners within the initiative, as well as external, sort of communities and individuals directly impacted by the issue area of focus. So there were challenges in both of those domains, especially in terms of feedback loops. So looking at this slide, what does it mean for how we think about the relationship between conditions? As I mentioned before, really backbone support and common agenda are the sort of those foundational elements contributing to the change. Together, these two elements really help facilitate mutually reinforcing activities and shared measurement. And then communication was generally less of a focus, and really just something that was sort of seen as largely the function of the backbone. So with that, I will turn it over to Terri to talk us a little bit about the equity findings.
Thanks. Yeah, so one of the areas that the field has a real interest in is the issue of equity. Equity is a growing concern for collective impact initiatives, because the assumption is that if you have meaningful change happening, that needs to happen across the board, and that you may need targeted strategies and prioritization that really allows you to target those gaps and change the systems that are creating barriers to all, to everyone having successful outcomes. So there is this sense that within the field that if there's not an intentional focus on equity, the persistent gaps that we do see in the outcomes are going to continue to exist. And then unless we really change our focus, that's not going to move the needle as quickly or as much as we want it to happen. So I did want to give a little framing. You know, there's a lot of definitions, perspectives, et cetera, out there about equity and what that means. So I wanted to be clear about how we were defining equity for the purposes of this study. We did define it in a fairly narrow way. We wanted to be for it to be more measurable in terms of what it might look like within collective impact, rather than sort of a deep critical analysis of the different factors and what kinds of systems, et cetera. So this is the definition that we used, that it's fairness achieved through systematically assessing disparities and opportunities and outcomes caused by structures and systems, and by addressing those disparities through meaningful inclusion and representation of the affected communities and individuals, having targeted actions and making changes in institutional structures and systems that remove barriers and increase pathways. So this is the framing that we use to think about equity. As Lauren referred to earlier, we did use some analytic rubrics to help us think about how to code the many sets of data that we had around equity and the conditions. And one of them was a rubric that we used that had 3 dimensions on it that we thought were important for trying to understand how equity shows up in collective impact initiatives. So the first dimension is what we thought of as capacity to engage in equity action. And this is these are things like having an explicit intent to focus on equity, having capacity building activities that help build the capacity of the backbone and the system and the partners within the initiative to actually engage in equity, shared language, and then some issues around credibility of the backbone and the leadership with the communities that they're working with. So it's the ability of those collective impact initiatives to actually engage the community and to think about how to do equity action. When we looked at our data, about a third of our sites, 8 out of the 24, have strong equity capacity, while about another third are emerging. So you can see that this is something that is emerging over time. Initiatives are beginning to take this on much more explicitly, and we might expect to see this pattern continue. The second dimension is equity-focused actions. And these are, you know, what this refers to is really targeting and prioritizing your work to address the equity goals that you have. So it includes things like using locally relevant and disaggregated data to understand the disparities, targeting the action to those greatest needs, building on community strengths and assets, and engaging in a deep structural analysis of the root causes and systemic issues related to inequity. You can see that there were, fewer sites here. Many sites with a stronger focus on this area use data strategies and communications, or that they targeted to specific populations. For example, we had several homeless initiatives that were in our sample who were really focused on, due to federal requirements, chronic and veteran homelessness. So many of their actions were targeted towards those populations to increase the opportunity for affordable and safe housing for those groups. The third area that we looked at in terms of equity-focused action was meaningful inclusion and representation. And this really has to do with sharing power, including those with lived experience, being adequately represented in the leadership and the work, shifting the power dynamics to those affected by the problem, and successfully engaging those who typically don't participate and who have a real stake in the problem itself. We had a couple of examples of where this was done very effectively. In those initiatives, they used a very strong grassroots organizing kind of approach to engage the community, and the problem of practice, the strategies, everything sort of emerged out of that community itself rather than coming from the system leaders. So as similar to what Lauren showed earlier about the conditions, we did try to look at what are the relationships between the different components of the equity actions and getting equity-focused outcomes and systems changes. And just to step back just a second, when we think about equity-focused outcomes, we think of those outcomes that are specifically targeted to reducing gaps or increasing opportunities. So both on population change and systems change, we're looking at very targeted kinds of changes. So it might be, for example, that the systems change is some sort of policy that increases access to, dual enrollment for students who have English language learners, who are English language learners. So it's a very targeted action. The systems change is the policy change, but it's specific to trying to increase the opportunity for that group. Similarly, with the population change, we might be looking at reducing gaps. So, increasing, access for different groups so that everyone has equal access or equitable access to something. So if you look at this graphic, we were able to sort of pull out, well, this is not causal, we're able to pull out some relationships that seem to be interesting in terms of how the equity components sort of relate to the different kinds of outcomes, the systems of population outcomes. So one of the things that we found is that capacity is strongly related to both targeted action and meaningful inclusion. So you have to have, I think, in place this idea of having strong capacity to engage in equity to actually have the equity actions and the inclusion happening. However, the targeted action and meaningful inclusion aren't really related to each other. So you could have a pathway of having capacity that leads you to some action, which might then lead you to changes, or you might have some capacity that leads you to more inclusion. But those two things, action and inclusion, don't necessarily happen together. All of them are related to positive changes, although we found, interestingly, that sites with strong inclusion were not necessarily the ones that had the strongest outcomes. So there's something to unpack there around what that means. It might mean that if you are very much using inclusion and representation as a mechanism, that process might be somewhat slower, or that it might be, there might be some alignment in terms of what are the outcomes that are happening. So there's some things to unpack around that. We found that equity commitment doesn't really directly lead to population change. What it does lead to are systems changes that support the population changes happening. So what's happening is these equity efforts are really targeting changing systems in ways that allow barriers to be removed, or new opportunities to be put in place, new pathways to be put in place that then sort of clear the path for successful population outcomes. Like this is our colorful chart. But what this is this slide shows you are all of the sites that we looked at and how they ranked on the 3 equity action components: capacity, representation, and action. Those are the purple boxes that you see. The pink boxes are their ratings on systems change, equity-focused systems change, and the orange boxes are their ratings on equity-focused population change. And you can see from the little key there that the darker the color, the higher the rating. And these ratings were assigned using the equity rubric. So we had ratings that ranged from very strong to not present. So the white boxes would be not present, the darker boxes would be the very strong ratings. And so you can see that these sites sort of grouped into 4 buckets. The site where you see the most darkly colored bars, the first set of boxes there, are the strong equity sites. They're the ones that are really, they're much stronger in terms of their capacity and their targeted action. They're strong, they're emerging to strong in terms of representation. Almost all of them are seeing strong systems changes, and most of them are seeing strong population changes. So for these 8 sites, equity action does seem to be really strongly connected to systems change and population change. The next set of sites that you see down below that are a little bit larger set of sites. And in this set of sites, what we call these are emerging equity sites. So there are lots of examples of different parts of equity happening. So they may have a common language about equity. There might be some capacity building happening. They may be starting to target their actions. They may be starting to do some inclusion and representation, and subsequently are starting to see these changes in systems and population. But as you can see, that it's much less so than the sites above. But these are sites often that are starting, that may have started without an explicit equity focus, and within the last 2 or 3 years maybe have decided that an equity perspective is the way that they need to go. So some of these sites are earlier in the work around equity than the sites above. We also had a set of sites that were the very last set you can see are mostly white. So that's sites that really didn't have any focus on equity and really weren't focused on any kind of equity change. One of these, for example, was a site that was focused on environmental change, and they were looking more holistically. They weren't the idea of sort of equity in terms of the environment was not on their radar. So that's one example of that. But the set above that, where you see the dark purple, you see the white for capacity, you see the dark purple for targeted action, and you see the white for inclusion. Those sites are showing pretty strong population change. And those sites are sites where, based on either regulations or requirements of programs, they are focused on a specific population that is deemed disadvantaged in some way. So the homeless sites that I referred to earlier are an example of that. There was a site that was looking at economic development within a very economically depressed area, very focused in that area. So these sites they got higher action scores because they are targeting, but they do not have all of the components of inclusion and having some capacity, and those changes are happening as a result of those more targeted actions. We wanted to take just a little bit of time and talk about some implications for both practitioners and for the community. So first, I wanted to talk a little bit about what are some of the implications of this study. What is all of this information that we've pulled together across these 25 sites have to say? And so I think there are really 5 sorts of basic implications. The first one is that collective impact's a long-term proposition, and that it's worth the time and the effort to define the problem and the target population clearly. So where we saw more population change was in situations where there was a pretty clear definition about what the problem was and who was being targeted. So it's really important to sort of examine how the populations are currently defined and ask whether there's more narrowly defined population would be helpful in focusing the work. The second piece of this is in terms of being clear that there are some foundational pieces that need to be put in place. So for example, Lauren talked earlier about the importance of the backbone in the common agenda, that those 2 foundational pieces are really important for setting groundwork for the early changes and the systems changes. So the backbone's role in sort of driving the work and convening folks and strengthening collaborations, and the common agenda in terms of focusing the work is really important. When you think about systems change, systems changes can take many forms. Lauren talked about this earlier, that there are programmatic systems changes, there are more structural systems changes, and that systems change is iterative. So what you may see early systems changes that are changes in programs, changes in policies, that then translate into more formalized, institutionalized systems changes that work across sector. It's important, I think, to keep in mind that there's no right answer for what systems changes are needed. and that what systems changes are needed are going to be highly dependent upon what your focus population is, what your focus problem is, and that there might be many different kinds of systems changes that can advance what you're trying to do. You could have some systems changes that have a direct impact on the problem, such as creating specific programs that build capacity or skill. You could have systems changes that create a supportive environment for the work to happen. So both of those are important kinds of systems changes, but have implications for very different kind of work. I do think it's also important to think about whether there are systems changes that might not be helpful. So it might be, thinking about as you are implementing policies or programs, whether there are unintended consequences around those that might exclude or have negative impacts on different parts of the groups that you're trying to influence. So the next implication has to do with equity, and I think it's important to note that equity can be achieved through different routes. The story can be different for different initiatives. We have initiatives that were very much grassroots oriented, embedded in the community, driven by the community. We had system level initiatives that did a very good job of engaging partners and the community, but we're working more at the systems level. So it's really important to be aware of what you're trying to do around equity, how you define the problem, and also just being aware of where your partners are and where folks are in the initiative around this issue. The second piece of the equity piece I think is important is that we often heard from folks we aren't doing, we need to figure it out first. And so I think it's important to sort of keep in mind that you shouldn't stall the work just because you aren't at the end of the journey. Equity is a journey, and doing something, learning from something, engaging your community and learning together is better than not doing anything. Then finally, for implementers, thinking about the different roles that collective impact can take in driving change. In Lauren's first slide, she talked about that there were, sites where it was really clear that the collective impact initiative had a direct impact on the population change that was happening, and in other sites that wasn't as clear that there were other things. Collective impact can have an influence in a lot of ways. It could be direct in terms of providing, actually directly influencing an outcome, or it could be more indirect in creating supportive conditions, helping facilitate a set of conditions in the environment, sort of taking advantage of specific things that are out there. So for example, in one of the homeless sites that had very strong relationship to the population change, they were able to really leverage the federal requirements and to bring together multiple agencies and multiple homeless initiatives to be all working around the same system and implementing the same sorts of services and systems across the whole county area. So there are lots of ways in which that can happen. These are just some additional implications for community members that I think are important. I think it's important, for example, to assess potential success. Communities are being asked to participate in different systems-driven planning processes all over the place, and it can be really hard, I think, for them to make judgments about which ones are most worth their time. One way to make that judgment is to assess whether the process is intentional and participatory in how the initiative is selecting its backbone and defining a common agenda. So what is the role of the community in the collective impact initiative from the beginning? I think it's really, really critical that these two kind of initial steps around selecting the backbone and what the common agenda is are really important for the communities most affected to be involved in. Communities can help improve the process. If those early processes are not effective in engaging the stakeholders, the community can play a role of really raising that as an issue and to be a strong voice and slowing down the process so that those things can be put in place, that the community voice can be heard, and that the community can help define those. I think it's the importance of being patient and maintaining a sense of urgency is a real tension. Oftentimes, social change initiatives feel very slow, like they're not making the change as quickly as possible. So it's important to be patient with the pace of change, but also to continue to be the voice of urgency around pushing that forward. Similar to what we talked about with the implementers, it's important to know that there are lots of avenues for change. There could be, multiple pathways to get to the goal, and community members bringing that perspective of what are the pathways that are most appropriate for them, I think is really important. And then I think just creating awareness of the existing work that complements and supports what's happening. Knowing that collective impact initiatives can play a range of roles from leading to supporting, one of the critical first steps is identifying how the initiative will fit into the broader environment. So what else is happening in the community, and how can collective impact really support that work as opposed to work at cross odds with that? So with that, I'm going to turn it back to Galen to facilitate our questions and go from there.
Perfect. Thank you so much, Lauren and Terri. I mean, you covered a really wide range of ground on your work, and obviously there's been lots of work done to develop these findings and recommendations. I was particularly interested around the implications and recommendations you made at the end are really, really interesting to explore. I even jotted down a little note here about, we shouldn't stall equity work just because we feel that we're not all finished and set to do equity work. And I think that was a really key kind of takeaway for me. So this is the time where we can turn it over to everyone who's listening and watching to actually engage in a Q&A session. So absolutely use your GoToWebinar chat tool to send your questions to us. And I wanted to just give us a quick start on a question that we got before the event. And it's really about using evaluation for empowerment. I think it's a really interesting one. So this question is, do you have any ideas on using evaluation for empowerment? So particularly not just collecting data to understand whether we have or have not had an impact and to what extent, but actually using data to empower communities to see what changes happen and help to build momentum for change in the future. I'm curious if either of you have any thoughts on that.
Yeah, I'd be happy to start, and then Lauren, if you have anything you want to add, that'd be great. One of the initiatives that we was part of our study was the Arise initiative in Anchorage, Alaska, and they are focused on providing supports for Indigenous students within the Anchorage School District. And they had a very interesting approach. They were one of the grassroots organizing sites that we talked about, but they actually engaged the parents in sort of defining the problem that they wanted to address, and then provided support to the parents to actually collect the data that they needed to formulate the strategies that they wanted. So the initiative itself was the tribal corporation there in Anchorage, and provided some support to the parents about what kind of information they needed, how to collect it, and facilitated them being able to talk to the right people. They took that information then and processed it and came up with the solutions that they wanted to be implemented around. This was around early childhood, and then reached out to the initiative, helped connect them to the partners that they needed to be able to implement those solutions. So it was a very different approach than many of the collective impact initiatives, in that it built capacity of the community members to define the problem, collect the information that they needed, and make sense of that to have solutions that fit for them.
Yeah, that's a great example. Thank you for sharing that. Okay, so we have another question here, actually about the role of funders in collective impact work. Uh, so really looking at whether you studied or looked at the role of funders in your work, and if so, any kind of perspectives for funders on how they can be effective, or how funders contributed to impact. I'm curious if that was part of what you looked at.
Laura, do you want to answer that one?
Yeah, I'll start off. So we did look a little bit into to what extent the backbone was a funder, and so in some cases we did find backbones that were also funders, and I think that presented in different situations both opportunities and challenges. So I think just there's a little bit more to unpack there in terms of, yes, there are benefits to having a backbone be a funder, but that can also present some power dynamic challenges, and just being able to acknowledge and kind of openly navigating those is one potential area I would think about. We did look at funding as being, and I would say that the majority of initiatives identified funding as being a critical component of something that was necessary to be able to further the work. So, for example, one of the initiatives we looked at in Connecticut that was focused on juvenile justice reform has been able to really benefit from long-term stable funding to sort of fund backbone, sort of core capacity operating expenses. And that's something they point to as being really critical as in advancing the work. So I think there's also a consideration to think about the value of funders in being able to fund sort of general operating expenses. That's something that came up at the Collective Impact Forum, and folks felt, especially from the nonprofit sector, pretty strongly about, and I think that was definitely mirrored in our study as well. Terri, I don't know if you had anything else to add on that piece.
No, I think that's right. I think you're right there, Lauren, that it presents opportunities and challenges that need to be further unpacked.
Great, thanks so much for that. And I know that was definitely, yeah, the forum and the convening was quite an important topic for people. So again, it's really exciting to see it come up here, and that you've been exploring that. One other question that we just got in is really looking at scale. So, I know that your sites kind of were in a variety of different locations and working at different types of scale. And we have a question about whether you did any analysis on whether there were differences in results that you saw versus smaller centers versus either larger collectives or larger metropolitan areas, and if there were any differences that you saw in the work coming up.
I'll start. So that wasn't an explicit lens through which we looked at in the analysis, but we did have examples of statewide work, I would say. So for example, the juvenile justice reform work I mentioned in Connecticut, as well as I can think of another example offhand in Colorado, focused on prescription drug abuse prevention, were statewide level efforts. So we did have both statewide as well as citywide efforts. I mean, just in thinking about the statewide work, one thing that comes to mind is just the challenges that they can cite in terms of being able to connect to local communities and really being able to do the work sort of in partnership, meaningful partnership with local jurisdictions. That requires setting up structures and processes to do that. Otherwise, it's very difficult to sort of maintain that local connection, especially if you're looking to facilitate change at the community level. So I think that is a particular challenge, but also I think opportunity for statewide initiatives, because then you also have the opportunity to more closely influence statewide policy change, for example, which we saw in both of the statewide initiatives, pretty significant state level policy change. But there's just that then need to be intentional in terms of developing the structures to connect to the community infrastructure.
Yeah, that age-old tension between what scale you operate at and losing connection on the ground when you work at a broader, more systemic scale and back and forth. So yeah, thank you for sharing that example. One other question that we had, which I think looking at the time will just probably be our last question for today, is really looking at the influence of time in the study. I know we talked about a little bit how organizations were and collectives were in different stages in their maturity. And we had one question about the correlation between system change and population change and time. So is it, are the changes that we see simply a function of the duration that the collective impact initiative has been around? Or are there some other factors that you think were also important in driving systems change and population change? I guess I'm curious about how you see the role of time and other factors in this work.
I do think that time is certainly a factor, and one of the things that we tried to control for with the study by having initiatives that had been in place for at least 3 years. And we had initiatives that had been in place for 3 years and initiatives that had been in place for much, much longer. For example, Elizabeth River, I believe, started in 1991, so a very long history. And so, time is important, but we did see some of the younger ones in our younger sites in our sample who were seeing pretty significant systems and population change. And I think it had more to do with their ability to focus and target their work and to bring people around that common agenda much more quickly. And I think that's why those foundational components of having being able to have a very effective and credible backbone and have that common agenda really do, I think, provide that foundation for achieving those systems changes more quickly. Laura, is there anything you would add to that?
Yeah, I think that's exactly right. And so I think one opportunity and limitation of the study is that we, as Terri mentioned, we selected sites that appeared to have strong implementation and strong outcomes. So when we got to the analysis portion, actually 20 of our 25 sites did demonstrate some level of population change. And I would say that among the 5, it wasn't time that was the biggest barrier, although it was a component to why those 5 hadn't achieved change. It was much more about not having stalls or challenges with both the common agenda and the backbone components, as well as shared measurement, and just not even being able to say whether or not you'd made change because there was no way to measure it. So I think time is definitely important, but we tried to, as Terri said, everybody in our study, had been sort of at a sufficient level of time to see change.
Yeah, thank you for clarifying that. I think, just what I keep on taking away from this conversation is so much about where things are working well, and really I see a lot of inspiration for how we can move forward and continue to do collective impact work and to do it effectively. So thank you both for sharing your perspectives on that, and just really appreciate all your insight and all the work that you've done.
Thank you, Galen.
Okay, and of course, thank you to everyone who attended today, and also for all the thoughtful questions that came up. So I just have a few closing announcements to kind of set the stage for what you might be able to engage with next. So first, stay in touch. Stay in touch with Tamarack Institute and Vibrant Communities Canada. We try and publish the latest thinking, tools, news, and resources from the network. And you can get those by signing up to receive one of our regular newsletters or by visiting our online learning community at the link that's there. And also join us in 2 weeks. We'll actually be continuing this webinar series exploring the When Collective Impact Has an Impact report. It's a fantastic title. May 8th's webinar is going to feature Canadian leaders featured from the report, and that includes 2 Vibrant Communities members, Living SJ and the Saskatoon Poverty Reduction Partnership. We actually had a question come through during this session wanting to know more about those sites. So we will have lots of time to get into that on May the 8th. We also have Ottawa's Growing Up Great initiative as well as part of that. And then we will be concluding this series of webinars on June 7th with Paul Bourne and Mark Cabage talking about lessons learned in collective impact from our work with vibrant communities. And you can use the link at the bottom of the screen to register. Also, you can absolutely join vibrant communities to do more exploration of innovative ways communities are reducing poverty. And you can attend the Western Regional Summit, Cities Innovating to Reduce Poverty on June 12th and 13th. And if you're in the East, no worries. We will also be hosting an Eastern Regional Summit in the fall to make it easier for those of you who are in the East to attend. And we'll be releasing more details about that summit as they become available. So register now using the link below. And Cities Reducing Poverty members can email Lena, L-E-E-N-A, at tamarackcommunity.ca to register for your 2 free seats. Finally, thank you for attending once again. In a few days, you should get a follow-up email from us, which will include a link to the audio recording, as well as the learning opportunities that I've just mentioned. You can email Natasha at tamarackcommunity.ca to provide feedback about today's webinar. We are always trying to improve and build on what we do, and that absolutely cannot happen without your feedback. So please do share what you think, help us do better. And thank you again for joining us, and have a great day. Thanks again, Lauren and Terri.